California just locked the door on its biggest healthcare promise.
They really did. It is a massive U-turn.
Welcome to the Deep Dive. It is Saturday, February 28th, 2026.
And today we are unpacking a story that honestly feels like a major reality check.
Yeah, we are heading to California, the state that, usually likes to think of itself as the exception to the rules.
Right, the progressive laboratory.
Exactly. For years, the vibe there has been, we can do it all, we can pay for it all, and everyone is welcome. But today, the lab is closing down.
The money ran out.
It did. The headline here is startling. California is rolling back health care coverage for hundreds of thousands of immigrants.
Which completely contradicts their famous promise of universal health care regardless of immigration status.
So our mission today is to figure out why. We're looking at a collision between California's massive $12 billion budget deficit and a federal crackdown.
Because you simply cannot spend money you do not have.
Right. We have a huge stack of sources today to get through. We've got the state budget analysis, reports from the California Pan-Ethnic Health Network.
We also have some very blunt critiques from the Senate Budget Committee.
Yep, and some newswires breaking down a new federal policy called H.R. 1. So we are going to look at all of this impartially reporting what these sources say to understand how financial reality is forcing this retreat.
It's basically ideology meeting arithmetic, and the arithmetic won.
So let's jump right into the freeze, because
Yeah.
this isn't something that might happen down the road. It started on January 1st.
Just 2 months ago.
Yeah. What exactly changed on New Year's Day?
The welcome mat was pulled away. As of January 1st, 2026, there is a total freeze on new medical enrollments for undocumented adults ages 19 and up.
Okay, let's define Medi-Cal really quickly for anyone not on the West Coast. That is the state's version of Medicaid, right?
Yeah.
Free health insurance for low-income people.
Right. And California was totally unique here. They were using state tax dollars to offer full coverage to undocumented residents.
Because those residents are federally barred from getting regular Medicaid.
Exactly. But the new rule says if you have what they call unsatisfactory immigration status,
UIS.
right, EUISS. If you have that and you weren't on the list by December 30th, 2025, you cannot get in.
Unsatisfactory immigration status. That sounds like a very
It's
bureaucratic way of saying you don't have the right papers.
That's exactly what it means. It covers undocumented adults, sure, but also people on visitor visas who overstayed.
Oh, wow.
Yeah, student visas too. Even some asylum applicants whose cases are still pending.
So if any of those people walk into a county office today to sign up.
They get turned away. Flat out.
Now, I was reading in the sources about a grandfather clause. So this isn't a mass eviction, right? They didn't just hit delete on the database for everyone already on it.
No, not yet. If you were enrolled before that December cutoff, you are technically safe for now. You get to keep your coverage.
But there's a catch.
A massive catch, the paperwork trap.
Right.
You have to maintain your renewal paperwork perfectly. If you miss a deadline, if you forget a single form,
Or what if you move and forget to update your address?
you are kicked off instantly.
And under these new rules, once you are off, you cannot get back on.
Exactly. You are permanently downgraded to restricted medical.
Which means what, practically speaking?
Emergency only care. If you have a heart attack, they will save your life in the ER. If you get in a car crash, they will patch you up.
But ongoing care.
Gone. Chemotherapy, insulin, regular checkups, none of that is covered anymore.
Man. It sounds like a high-stakes game of musical chairs.
Mm-hmm.
The music stopped on January 1st. If you have a chair, do not stand up.
That is a great analogy.
Because if you lose your seat, you are out of the game.
Yep. Now, the only exception here is the kids. The sources are very clear on this. The freeze does not apply to children 18 and under.
Okay, so undocumented kids can still sign up for full coverage.
They can, but for the adults, the expansion era is officially over.
So let's get to the why. Because California hates saying no to social programs. It goes against their entire brand. What forced their hand?
The check bounced. I mean, look at the numbers in the state budget analysis. California is facing a $12 billion budget deficit.
$12 billion.
Yeah, the state just ran out of runway.
Which brings us to the conservative critique in our stack. We have these notes from the Senate Budget Committee and Republican lawmakers. And reading through them, they really sound like the I told you so crowd.
They certainly do. And looking at the data they provide, their argument is strictly fiscal. They argued that This expansion was fiscally irresponsible from day one.
Right. Their basic stance is that you cannot have an open border and a welfare state at the same time.
Exactly.
I actually have a stat here from the Senate Republican Fiscal Office. They point out that the previous expansion added nearly 700,000 people to the medical system.
700,000.
That it's a city the size of Denver just suddenly added to a safety net that was already struggling.
And that's the absolute crux of their argument. The critics argue that by offering free, full-scope healthcare to undocumented immigrants, the state did two major things.
Okay, what's the first?
First, they incentivized illegal immigration. The argument is, if you offer free healthcare, people will come to get it.
Right. It's basic economics. Incentives matter.
Exactly. And second, the sources argue it crowded out resources for vulnerable citizens.
Because the system has finite resources.
Right. There are only so many doctors, so many clinics, so many appointment slots.
So the argument from the right is that you created long wait times for everyone else by overloading the boat.
It's the lifeboat theory. Put too many people in, the whole thing sinks. And now the state is frantically trying to bail out the water.
Now, obviously, the advocacy groups in our sources see this totally differently. The San Francisco AIDS Foundation, for example, is absolutely furious.
Yeah, they're calling this a two-tiered system.
They are saying it is dangerous to have neighbors with different rights to survival just based on paperwork.
Right. And they argue that it will actually cost the state more in the long run.
Because people will just wait until they're literally dying to go to the emergency room.
Exactly, which is the most expensive type of care. But, the state legislature looked at that $12 billion hole in the budget and decided the math just didn't work anymore.
But wait, it's not just California's bad math, is it? There is a bigger force at play here, a federal force.
Yeah.
Let's talk about H.R. 1.
Oh, yeah. This is the part that really changes the game. This isn't just a state problem. This is a federal hammer coming down.
H.R. 1. It sounds so boring, like a tax form, but it's actually a massive policy shift.
It is. And to understand why this hurts California so much, you have to understand this little accounting trick the state was using.
The MCO tax.
Exactly.
Okay, let's unpack this because this feels like where the bodies are buried. MCO stands for Managed Care Organization. So basically, the insurance plans.
Right. For years, California used this very clever loophole. They would tax the healthcare plans, the MCOs. Then they would use that tax revenue to trigger matching funds from the federal government.
Wait, let me get this straight. I tax the insurance company $1. I put that dollar in the Medicaid pot. The federal government sees the dollar and says, great job, here's a matching dollar.
Yep. Now you have $2.
And here's the trick. The state would essentially find ways to funnel payments back to the insurance companies.
Right. So the insurance companies didn't really lose money, but the state generated billions in free federal cash.
It sounds like a money laundering scheme, but for the state budget.
It was a shell game, and it generated billions. But H.R. 1 puts a hard stop to it.
How?
The new federal law prohibits states from taxing Medicaid providers at higher rates than others just to game the system.
So the federal government basically said, we see what you're doing, and we're cutting up your credit card.
Pretty much. And the impact is devastating. It effectively kills a massive revenue stream that California heavily relied on to fund medical.
Imagine you are budgeting your household based on a coupon that doubles your paycheck. And suddenly the store says that coupon is invalid.
You're broke.
Yeah, you're broke.
Yeah.
And that's not the only hit from H.R. 1, is it?
No, it gets worse. There's also the FMAP reduction. That stands for Federal Medical Assistance Percentage. H.R. 1 cuts the federal matching rate for emergency services for the UIS population.
The undocumented group.
Right. It cuts that match from 90% down to 50%.
Whoa. So the feds used to pay 90 cents of every dollar for emergency care for this group, and now they are only paying 50 cents.
Starting October 2026, yes.
That's a huge drop.
It creates a $1.4 billion hole in the state's general fund instantly.
Wow. So you have a state deficit, you lost your tax loophole, and your federal match just got cut almost in half. It is the perfect fiscal storm.
And that is exactly why the freeze happened. It wasn't just ideology changing, it was bankruptcy prevention. The state finally had to admit it couldn't afford the promise it made.
Now, here is where it gets really interesting, and honestly, pretty shocking. We tend to think of this as undocumented immigrants versus the budget. But the sources reveal a massive twist here.
Yeah, this was definitely the most surprising detail in the stack.
This isn't just hitting undocumented people.
Not at all. The cuts are stripping full coverage from approximately 200,000 lawfully present immigrants.
Wait, lawfully present. We're talking about people who are here legally.
Yes. We are talking about refugees, asylum seekers,
Wow.
survivors of domestic violence who have special visas, trafficking survivors,
People the state invited in, people the federal government recognized.
people the state explicitly swore to protect. But here's the catch. Under federal law, many of these groups face a 5-year waiting period before they qualify for federal Medicaid.
Okay.
So for those first 5 years, their health care was paid for entirely by the state of California.
And since the state is now broke,
Since the state is cutting the state-funded program, these lawfully present refugees are getting swept up in the exact same net.
they're being transitioned to emergency-only medical too.
Yep.
That is a massive irony. California, the sanctuary state, is cutting off mental health services for trafficking survivors because their accounting trick fell apart.
It really highlights the danger of overexpanding. When you try to cover everyone using a budget loophole, you eventually run out of money to protect the people who are most vulnerable.
The sources specifically note that these 200,000 people will lose access to regular doctors and mental health care.
Right. They are fleeing trauma, and the safety net just snapped.
It really validates the conservative critique we saw earlier, that if you overload the system, the most vulnerable citizens and legal residents end up paying the price.
It is a harsh lesson in resource allocation. Real life has trade-offs. You just can't have it all.
Okay, let's look at the people who do manage to stay on the plan, the grandfathered group. It's not exactly a free ride for them anymore, is it?
No, the days of free are completely over. The state is tightening the screws everywhere.
How so?
Well, starting July 2027, adults ages 19 to 59 with that unsatisfactory immigration status must pay a monthly premium.
How much are we talking?
$30 a month.
Okay, $30.
Mm.
I can hear some people saying, that's not that much. But for a family living way below the poverty line,
It is a massive barrier. And remember the stakes we talked about earlier. If they miss a single payment, they lose coverage.
boom, you're out.
There is a 6-month re-enrollment window, but it introduces so much friction. It turns healthcare into a bill you have to constantly worry about, not a right you just have.
And from what I read, they're actually getting less for that money, too.
Much less. Starting July 2026, full-scope dental benefits are eliminated for adult medical members with UIS.
So no fillings, no cleanings.
Back to emergency extractions only. If your tooth hurts, they pull it. They do not save it.
Ouch. Literally.
Yeah.
But the most confusing part of this new policy has to be the work requirements. Can you explain that? Because it sounds like a complete paradox.
This is where the bureaucracy gets almost comical. California is applying federal work requirements to these state-only immigrants starting July 2027.
Wait, pause. These are undocumented immigrants. They aren't allowed to work legally.
Correct.
So the state is saying, to keep your health care, you must work. But the federal government says you cannot legally hold a job.
It is a massive catch-22. Advocates in the sources are calling it completely absurd.
I mean, it is.
They warn that up to 3 million adults could eventually lose coverage because they can't prove they are working.
Because they can't work on the books.
Exactly.
From a conservative perspective, though, isn't this the state trying to enforce some kind of contribution? Saying, if you're here, you need to be productive.
That is the intent, yes. It is an attempt to align with the new federal standards found in H.R. 1, but practically speaking, it acts as a massive filter to push people off the rolls.
If you can't show the paperwork, you are out.
It effectively thins the herd to save money.
It sounds like a soft eviction. You don't kick them out directly. You just make the rules impossible to follow.
Exactly.
Let's talk about the ripple effects of all this.
Okay.
Because when you cut health care for 500,000 people or freeze enrollment, it impacts other things. I saw a note here in the stack about IHSS.
Yeah, IHSS stands for In-Home Support Services. It pays for caregivers for the elderly and disabled.
Right.
But here's the kicker. IHSS is legally tied to Medi-Cal.
Oh, no. So if you lose Medi-Cal...
You lose your home care worker.
Wow.
This is going to hit families incredibly hard. If a grandmother loses her health coverage because of a missed form or the new freeze, she also loses the person who comes to help her bathe and eat.
And what about the clinics? The doctors actually on the front lines doing the work.
They are in an absolute panic. The federally qualified health centers...
The safety net clinics.
Right. They are losing their payments for treating these populations.
So they have a terrible choice. Treat the patient for free, go bankrupt, or turn them away at the door.
Exactly. And most businesses, even nonprofits, cannot survive by working for free. We are highly likely to see clinics closing down or drastically reducing their hours.
It is a contraction of the entire system.
It
It
is.
really feels like the pendulum has swung all the way back.
It really has.
So let's try to synthesize all of this. We have a massive $12 billion state deficit. We have a federal government enforcing strict fiscal rules through H.R. 1.
Right.
And we have a state government that is quietly retreating from its biggest, most famous promises.
It is a perfect storm that ended an era. The era of expanding immigrant health care in California is officially over.
We have moved from health care for all to health care for those we can afford.
And health care for those who follow the rules.
That, too. The fiscal conservatives have definitely won this round.
The math simply became undeniable. The sources lay it out. You cannot sustain a welfare state with open borders and a massive budget deficit. The numbers always win eventually.
It's a very sobering reality check. We are seeing the limits of state power when it clashes with federal policy and economic reality.
And that leads us to the really big question.
Right. What is the main takeaway for you, the listener, today?
Think about this. California is the world's 5th largest economy. It is a massive, progressive stronghold.
Yeah.
If California cannot sustain this safety net, if they have to cut off legal refugees and freeze enrollment because they are flat broke, is the concept of state-level universal health care officially dead in America?
That is a heavy question. If the Golden State can't pay the bill, who can?
Exactly. If it doesn't work there, it probably doesn't work anywhere.
We will leave you with that thought to chew on. Thanks for listening to this deep dive into the numbers, the policies, and the new reality in California.
Get informed.
We'll see you next time.